Good evening, everybody, and welcome to this webinar this evening. It is my pleasure. My name is Dr. Stephen Katz, and it is my pleasure to be presenting on behalf of NDX Labs with sponsorship from CareCredit. What we'll be talking about tonight is how to pump up your practice by increasing treatment acceptance. And again, I want to thank, just waiting for my screen to come live. But I want to thank National Dentex for hosting this webinar this evening. I've had a long relationship working with them, both as a lab and in conjunction with some promotional things. I also want to thank CareCredit, and we'll be hearing a little bit later from Lex Fogel from CareCredit, as they are probably the greatest sponsor of continuing education in dentistry, and we appreciate their support for this program. There's no one who can question that this has certainly been a difficult period these last several months. We've been challenged with our offices being closed. We've had to incorporate new protocols and procedures in order to see our patients. And it is certainly a difficult period, has been a difficult period for many. But how you view what's going on is a matter of perspective. So when it comes to perspective, if you were shown a glass that had partially filled with water, are you the person that sees it as half full, or are you the person that sees it as half empty? When you focus on what's coming, do you focus on what you want, or do you focus on what you have? Mount Rushmore is undoubtedly one of the most beautiful and majestic monuments we have in our country. And it is a tribute to the 4 presidents whose faces appear on that monument. But if you take a look at Mount Rushmore from the other side of that mountain, it is very much a different view. And that is a matter of perspective. Challenges in life can either make you bitter or better. And it's a good way to introduce my story a little bit. I have been a dentist for 36 years. I started my career as an oral surgeon. And after doing cancer surgery for several years, I got burned out and switched back to restorative and cosmetic practice. And I had a wonderful career. I was also the team dentist for the New York Jets and the dental consultant to Fox News. But 20 years ago, I lost my practice to a series of life tragedies, and I had to start over. And the 2 years that I was out on disability, having surgeries and recovering, gave me an opportunity to develop the type of practice that I had always dreamed of and what would be my vision. And I am very happy to say at this point in my career, my practice was everything I would have hoped for, and it has allowed me to move on and change careers at this point to one in which I coach practices on how to be successful. Not by focusing on the money, not by focusing on production, not by focusing on collection, but focusing on raising the standard of care, increasing the perceived value of the patient, what the patients have of that care, and teaching doctors and their teams how to communicate that value. There are 4 ways to increase a practice. You can increase your number of new patients. You can increase your capacity to do more dentistry. You can increase the number of high profit procedures you do. But far and away, the most effective way of growing a practice is to increase your case acceptance. Case acceptance does not begin in the treatment room when you're seeing the patient. Treatment acceptance begins from the very first time a patient makes contact with an office. How is that first phone call? Is it a welcoming phone call? Does the doctor, and this is something we recommend to all of our clients, does the doctor call new patients the night before their first visit? In order to be successful in these times, you have to develop ways to differentiate your practice from all the others in your area. Having a doctor call a new patient the night before a first visit is a true differentiator. At a time when many new patients, it's common to hear the complaint that new patients don't show up for appointments. It's because they don't have a relationship with the office. And for a doctor to call a patient the night before a visit to introduce themselves and to ask them a little bit about how they found out about the practice is really goes a long step in changing that relationship early on. We're going to talk a little bit later about a cycle of trust, and the doctor making contact and beginning that relationship before they ever come into the office is a way of shortening that cycle of trust. What's interesting is the way the patients come in after that phone call. It's usually telling the administrator at the front desk, do you know that the doctor called me last night? And that's when the administrator can say, of course we know, because Dr. Wonderful is so caring about his patients. He cares about you as much as a person as he does about caring for your teeth. The other thing that we have converted into and is important now in post-COVID is contactless check-in. Are you doing the things that paints your practice in light as being, number one, protective of their safety, and number two, being high tech? Being aware of the patient's first name when they come into the office, and having everyone in the office aware of their name so that as they walk through, they can be greeted by name by every team member who comes within 10 feet of them. That's what we call the 10-foot rule. And certainly in that first visit, you want to establish a relationship. Not to affect doctors' pride, but case acceptance is a team success. And the team is more important to that success than to the doctor in many cases. Because when the doctor walks out of a room, it's the team members who are asked by the patient, whether it be an assistant in the doctor's room, the hygienist in the hygiene room, or an administrator, whether they feel that the doctor's recommendations were valid. Don't you hate it when patients say, doctor, I'll think about it, or that I'm just going to do the fillings and wait on the crown? These are situations that the team members can often circumvent and then help the patients turn those potential objections into opportunities to do dentistry. It's very important that the members of the team know their lanes and stay in their lanes. All the responsibilities for a team need to be laid out well in advance, in writing, so that everybody understands what their role is in every function of the office. And treatment acceptance is certainly a major part of that. Unfortunately, what we see when we go into many offices is that the lanes are unclear, the responsibilities are unclear, and oftentimes there's overlap or things get missed. One of the things we profess is that we have clear written expectations of how employees are supposed to perform their tasks in cooperation with everyone else. And then we need to have regular evaluations of their performance by either the doctor or an office manager. This is an excellent form that we use for team evaluations. And if you'd like to obtain a copy of this form, please just send an email to coaching@smilepotential.com. And after the seminar today, tomorrow, or the next day, we will have a member of our team send these to you. If you would like any follow-up on how to use these effectively and the verbal skills that are involved, by all means, please give us a call or send me a text or send me an email, and we can talk about how to use it effectively. There is a path to treatment acceptance. The first step in that path is when we tell patients that they could benefit from some treatment. And that comes from the hygienist, it comes from the dentist, usually in one of the treatment rooms. But what happens when we tell a patient that they could benefit from treatment, they immediately go into the mode where they think about, can I do it? Can I afford it? Do I have the time to go through the treatment? And is it a good time with what's going on within my family? Those are all valid objections. How the patient is able to overcome those objections depends on the skill of our team in giving, number one, options of treatment, number two, options on how to pay through financing, and working out the arrangement so that it fits into their schedule and it fits into their budget and it fits into their family situation. And that's when a patient goes from, should I do that? Can I do it? To I will do that. And before we mentioned that there is a trust factor. And the gap between treatment that's presented and what is accepted is that gap of trust. If we develop greater trust early on and greater understanding, there is a greater likelihood that patients will accept treatment. It is the understanding that drives treatment acceptance. And that level of understanding is a two-way street. Do we understand what it is that the patients really want? And does the patient understand that we are here to provide them with treatment that they want? And notice I say want instead of need. We're going to speak about that a little bit later. So when we talk about understanding, there are three major factors that affect understanding for a patient. Affinity, A, affinity, B, believability or trust, and C, communication. Affinity is whether they like you, believability is whether they trust you, and communication is how well you are able to get your message across. So if in most cases we see communication lacking, we start to see that triangle that represents understanding decrease in size. And as the size decreases even more, now we have a lessening of the trust, and ultimately we have lessening of the likability as well. And what we find is when there is little affinity, little believability, and poor communication, that is when we get case rejection. However, if we are able to address the communication issue and improve our communication, then we start to see that triangle representing understanding increasing, and we start to see the trust increasing, and we start to see the likability increasing, and ultimately we have a full level of understanding where then again we get higher case acceptance. If you'll excuse me for 1 second, I'm going to try to switch to the other mode of showing the slides. And doesn't seem. Okay. So we give a presentation that's called a blueprint for $300,000 growth in any practice. And I'm going to use as an example for this blueprint a benchmark type practice, $1 million practice, where the doctor works 32 hours a week, and that's an important figure. A doctor should be able to support their lifestyle seeing patients 32 hours a week. If not, there's either something wrong with the practice, or in many cases, there's something wrong with the lifestyle. In this particular case, the dentist is producing $500 an hour. They work 48 weeks of a year, and the hygienist is producing $150 an hour. That $500 an hour production for a doctor and $150 an hour for a hygienist in a 32-hour-a-week practice is the blueprint for producing $1 million. Now, what I'm going to tell you is right off the bat is that I am as ethical a doctor as you will ever meet. I take pride in the fact that I never did any treatment for my patients that they didn't need or that they didn't want. And it was certainly my goal to impress upon them how they could benefit from the treatment in a totally ethical way. But as I visit practices all the time, and it's been hundreds of practices in the last few years, I can tell you that one of the biggest problems is failure to diagnose properly, and then failure to enable patients to accept the treatment that they could benefit from doing the proper diagnosis. And from looking at x-rays and looking from teeth that doctors have treatment planned, what I know for a fact is that if a doctor would diagnose one additional resin a day, that would, and let's say that resin were $200, a fairly modest fee, that would result in a $25 an hour increase on that particular day. And if you expand that over the course of a year, that would be a $40,000 increase over the course of a year by doing one additional resin a day. If a doctor were to do one additional crown a day, that would result in a $125 an hour increase for that day. And expanded over a year, that is a $200,000 increase. And I can tell you, we're going to talk a little bit later about approval addiction, that there are so many times when doctors are fearful of telling a patient of the treatment that they really need. And in doing so, they tell them an alternative treatment that they feel will scare the patient off less. And we're going to go over tonight some communication skills so that we can tell patients how they can benefit from the best care that we're able to provide for them. This formula of one additional resin a day, crown a day, also applies to hygiene. And this is an area where, through analytics, we know that most practices, if you take their population, that the population of a practice, of a community, 75 to 80% of the patients have periodontal disease. So why is it when we go into a practice and we do the analytics, we find that 90% or more of the patients are oftentimes receiving preventive procedures, such as a prophy? So it's extremely important, and what we teach is expanding the role of hygiene in a general practice, that we do a thorough job of evaluating patients for periodontal disease. That means full probing of every patient. And then based on what we find, converting those patients to the appropriate periodontal care. If you have any questions about this concept, please reach out to me after the webinar and we can arrange some time to talk about it. But if we converted one prophy a day to a scaling or root planing procedure a day, that would increase the production of the practice by $160 or $20 per hour. Over the course of a year, that's a $30,000 increase. And this even applies to some of the adjunctive services that we are capable of providing through hygiene, whether it be sealants, whether it be fluoride treatments, whether it be night guards, is something that certainly can be provided through the hygiene department. And when we put all of these things together, the additional resin, the additional crown, the additional scaling, the additional sealant, the additional fluoride treatment, that is where we see a $300,000 automatic increase in every practice. And I can tell you that in 2019, up through 2019, my partner Kelly and I have worked with 94 practices in the last 4 years, and every single one of those practices has increased by at least $300,000 or more in the first year. The average increase in practices that we work with is $514,000. Case acceptance goes way up when you and your team connect with the patient on an emotional level. You must stop trying to teach patients dentistry. People make their decisions about dental treatment based on emotion, not education. And I know we like to use our dental words, we like to use our technical words, we like to use our science words. But quite honestly, the more we use those words, the more we confuse patients. And when we talk about treatment acceptance a little bit later on, we're going to talk about simplifying it so that we hit the emotional end of how these dental conditions create life disabilities. And when we connect with the patient on an emotional level, it significantly increases the amount of dentistry that's accepted. See, the thing is, when we start to talk technical words to patients, it confuses them even more. And it's almost like when we speak to somebody who speaks a different language, and when they don't understand us, we start to speak louder or we speak faster, and then the comprehension is even less. So we have to get over the fact that as dental nerds, science nerds, dental professionals, we have teeth on the brain. And our patients are not able to connect with the terminology that we use, no matter how smart we think they are. This is a great slide in our live presentations because the song that goes along with it is "You Talk Too Much." And that's something that we see in every dental office that we go into. that if a patient is not comprehending the value or the benefit of the treatment, then we go into much more detailed explanations about materials and line angles and surfaces and function and everything else. And all of that talk just confuses them. The last line in the song, "You talk too much," is, "Baby, if you keep on talking, baby, if you keep on talking, you're going to drive me away." And that's what we do all the time in our dental practices. There are 3 levels of understanding. And the first level of understanding is what we're taught in dental school, hygiene school, the chief complaint. It's a condition, and that condition is easy to recognize, whether it be a toothache, whether it be a chipped tooth, whether it be bleeding gums. And it's also easy to give the solution to that by saying a crown, a root canal, or periodontal treatment. What we really need to understand is those solutions to the conditions do not motivate or inspire patients. So what we have to understand then is that these conditions create problems or disabilities in the patient's lives. So for the patient who has a toothache, they tolerate the toothache. They take some Advil, they take some Aleve. But then what happens is they go to work and they can't concentrate and they're distracted. Or they come home in the evening and they attempt to do homework with their child, math homework. And all of a sudden the child makes a mistake and they blow up at their child. They've tolerated the toothache. The problem, the disability for them, is that they can't tolerate how it affects them in their life. What about the patient who has some sort of cosmetic problem? Here in Long Island, oftentimes patients will go to steakhouses on Thursday nights, this is before COVID, for singles nights. And what happens on one of those evenings when 2 people are getting to know each other, and the entire time of that conversation, one person is looking at a chipped front tooth in the mouth of the other person. That other person doesn't feel as sexy, they don't feel, they're embarrassed, their self-esteem goes down, and it's not a successful evening. And it even goes as far as patients who wear various prosthetics. A gentleman who is retired and trying to play tennis with his friend finds that due to mandibular atrophy, his lower denture is flopping around in the floor of his mouth. At one point, running around the tennis court, it falls out, and he scoops it up and he puts it back in his mouth. Then he goes to lunch, and the entire time he's at lunch, he has his finger in his mouth trying to get food out from underneath the denture. Does he care about mandibular atrophy? Does he care about the fact that he has a ill-fitting lower denture? Or is he concerned with the fact that he can't enjoy life? He can't have fun, and he can't enjoy eating. So we have to understand that these problems and disabilities are caused by the conditions in the mouth. Now, we shoot ourselves in the foot if we start to give the dental solutions to these life issues, because then we take ourselves right back to talking about condition. So what we really need to understand is that in order to inspire a patient, we have to be able to talk about the benefits of the treatment, not the treatment itself. So giving you an example, a woman comes into my office and my question is, "Mrs. Jones, how can I help you?" Well, she may say that she has a chipped front tooth. Now I want to get to the emotional side of this conversation. So I will ask Mrs. Jones, "Tell me when you first noticed that that tooth was chipped." And she might say, "Well, I was at my grandson's birthday party and he pointed at it and started laughing, and then all of his friends were making fun of me." That's terrible. Now I want to get to the emotional side. "Mrs. Jones, how did you feel when that happened?" And that's when she'll express that she was embarrassed, she was ashamed, that she didn't want to sit in the picture with her grandson with the rest of the family for his birthday. That is when we have the ability to inspire patients by talking about the benefit. Many times I ask this question in live presentations, what do you think the most important piece of equipment is in a presentation room? And inevitably people say models, photographs, various types of educational equipment that we might have. But I will tell you that the most important piece of equipment in a consultation room that automatically ensures that the patient is going to go through with the treatment is a tissue box. If we can bring a patient to the point of emotional pain, that they understand how the dentistry can change their life, they will not say no to the treatment. So the response that we would give this patient would be not let's go inside and fix your tooth, but Mrs. Jones, how about we go inside and let's start doing some things that are going to restore your dignity, restore your self-esteem, make you less ashamed, make you look 10 years younger. And next year, when it comes time for your grandson's birthday, you're going to want to be right next to him in the front of the picture with the rest of the family. You see, what it is that inspires our patients is what we listen to every day in our minds. In all of our lives, we are all listening to the same radio station all day, every day, WIIFM. What's in it for me? So if we can provide the patient with some satisfaction of the benefit of the treatment, they will be much more likely to go forward with that treatment. Now, there's a major problem that we have in speaking to patients about treatment. If we tell them too much bad news, we're always afraid that we're going to overwhelm them. And if we overwhelm them, they may not like us. And if they don't like us, they may go elsewhere for the treatment. That is the approval addiction that we were speaking about a little bit earlier. So what is the challenge with needing approval? It is how do we separate the message from the messenger? And the skill that we teach to do this is something called the permission statement. If we get permission from a patient to tell them what we see and how they think they could benefit from care, and they give us the permission, then they will not get angry with us. They may get frustrated with the fact they didn't take care of this perhaps at an earlier point in time. So the way the permission statement goes, and I recommend using this at the time of a first meeting or at the time of a treatment presentation meeting, is Mrs. Jones, I hope you've seen by the way we've cared for you so far in the office that relationships are extremely important to us. In keeping with that, what I would like is your permission that I can be honest and truthful, tell you what I see, and often if I think there's something that you could benefit from in the way of care. The flip side of that, Mrs. Jones, is that I give you permission to make all the decisions. It's your mouth, and I understand that there may be some things in your life that may affect what decisions you make. I just want you to know that from this point forward, we will be partners in coming to the best decisions for you. That is an epiphany for many doctors, because if you look at the patient's posture, it changes. They start to relax. They start to lean in. They start to evaluate that mutual understanding and respect. And they start to feel that you're not typically the type of professional that's just telling them what they have to do. Patients are sick and tired of having physicians, dentists, accountants, attorneys tell people what to do. They welcome the ability to be partners in the decision process. Another thing that goes along with this is posturing. In many consultations, number one, if this is being done in a treatment room, the patient must be seated up. You cannot have a conversation with a patient in the supine position. It is a vulnerable position for them to be in. Number two, if it's in the treatment room, I recommend raising the patient's chair and lowering your stool. Just the psychology of being on eye level or even having the professional look up to the patient has a huge significance in how that communication goes. If it is done across a desk in the consultation room, what I recommend is having the doctor's or the administrator's chair lower and having a taller chair for the patient to sit in. A huge problem that we see in offices all over the country is doctors watching things. The hygienist goes out on a limb tells a patient that there is some care that can be given that the patient would benefit from, the doctor comes in and says, let's watch that. And that has a couple of plays here. Number one, we're going to talk later about the communication between hygienist and patient, hygienist and doctor and patient. And if we have a hygienist that goes out on a limb to try to do what she feels is correct, and we're going to talk about how photography plays into that, if she is put down in this type of way time after time, she is going to be less likely to stick her neck out and try to recommend things that she believes the patient could benefit from. The other part of stop watching is that we deprive patients of a right to make a decision when we watch something. We also take ownership of the problem. When we tell a patient that we're going to watch an incipient area of decay, an area of periodontal disease, what we're telling them is that we're going to take care of it for them. But we do not have any control, as we've learned over the last 7 or 8 months, of what happens. And what happens to a patient who can't come for almost a year because of a pandemic? What happens to a patient who goes away for spring break and hadn't taken care of something incipient, and now they go a year before their next checkup, and given the opportunity to foster even further decay by being a student in college who's sucking down Red Bulls all day and not brushing their teeth and flossing properly, now all of a sudden they come back with a much more severe problem, and we tell them it needs more advanced treatment. And what do they say? But doctor, you said you were watching it. They don't take responsibility. Another factor in the stop watching is the fact that many patients, if given the opportunity to do something proactive, would choose to do treatment that is proactive. So in a case like this, a parent who is told that there is the beginnings of decay, that it is something that they can choose to treat now or wait and have more extensive treatment later on, there are many people who would opt to choose for the more conservative treatment now. And isn't that what our role is? To give patients the opportunity and the right to make decisions for themselves. Another huge problem that we see that cuts down on treatment acceptance is the fact that we undervalue what we do all the time. We do it in many ways. We say that there is a little cavity, a tiny area of decay, a minor area of inflammation. We question things that maybe we should do this or maybe we should do that, and we raise question marks in the patient's mind. Or maybe it's in the way we paint the value of hygiene. Do we say that it's just a cleaning, or do we talk about the fact that it's periodontal maintenance and an oral cancer screening? When we say just a cleaning, when we use these minimizing terms, we face the possibility of a disconnect when we give treatment that may, in the patient's eyes, be a disconnect with what the extent of the problem is. Too often, I've watched on observations of a hygienist telling a patient that they have a small cavity on the distal buccal root of an upper second molar. And the doctor comes in, and we all know what happens when there's decay in that area of the patient's mouth. And it starts to wrap around the root, and it's fairly close to the nerve. And now that patient with the small cavity comes out to the administrative desk, and the administrator tells the patient that it's $3,000 for a root canal, a post, and a crown. And what's the reaction of that patient when that happens? But the hygienist said it was a small cavity. We have to under-promise and over-deliver. When we use minimizing terms, we're over-promising in the interest of approval addiction, and then we're faced with the possibility of failure and poor understanding when we give a treatment that seems like a disconnect. The best way of getting patients to understand the problems we're seeing is using intraoral photography. And we hope that all of you listening in today have an intraoral camera. More importantly, we hope that you're using it on every single recall patient that comes into your practice. And what we require is that the hygienist, take 4 photos minimally on every patient. If there is nothing bad, then take a picture of something good and show them how beautiful their teeth should look. But oftentimes we can combine things that are problems with something that we have restored previously and show patients the contrast to the problem area and then how it is resolved. And what we recommend is doing a full tour of the mouth using that intraoral camera. And sometimes the patient will see something that makes them feel happy. Now, this was probably in our tours of the mouth, the happiest little bicuspid we had ever seen. Now, this is a bicuspid that we hope no one would say has a little cavity in it. And we're going to go over the communication a little bit later of how to inspire treatment to want the proper care. Aside from the intraoral photographs, if you would like to do more cosmetic dentistry or more comprehensive dentistry, then using the retracted smile is certainly a good way to get this going. Now, when we like to show this in a consultation with the patient, even before they make it back to one of the treatment rooms, and have a conversation that goes like this. Mrs. Jones, this is a picture of what other people see when you smile. Tell me what your thoughts are. That's a very different approach than saying, tell me what you think about your smile. Most people look at their smile every day in the mirror and they live with it. People are more concerned, and again, this gets back to the emotion, people are more concerned with how their appearance affects what other people think of them. So when you put it in terms of this is what other people see, tell me what you think about that, that's when you're going to have a patient who's leaning forward and pointing to the discolored filling here, the periodontal disease on the lower. And that is where we have the ability to talk about functional problems. I have a philosophy. Now, I'm very fortunate that I had a practice that I was able to do a lot of comprehensive cosmetic and full mouth dentistry. But my philosophy was that every patient who walked into my practice was potentially a full mouth reconstruction until they proved otherwise. Now, I will tell you that 95% of the patients did prove otherwise, but I preferred looking at it from the outside in as opposed to focusing on tooth by tooth. And when you look at a case like this, between the decay problems, the restorative problems, the periodontal problems, the crossbite, the functional problems, the 2 planes of occlusion, the alignment problems, this becomes a full mouth reconstruction. But too often in many offices, we see that doctors are focusing on this tooth here, or this tooth here, or just this area here. We want you, by using the permission statement and broadening your diagnostic skills, to be able to present full mouth dentistry. What's interesting, when a patient looks at a photo like this, they may pick out something that you are not aware of. They might point to this white tooth down here and say, why is that molar white? I like that. I'd like the rest of my teeth to look like that. And when you start combining with everything else that's going on in this mouth, that's how we start to develop full mouth reconstructions. Also, another important photo to take is the occlusal mirror shot. And this is of extreme importance if you want to increase the amount of quadrant dentistry, full arch dentistry, implant dentistry. And when you show patients like this, we can try to explain function and till we're blue in the face. But when they see these types of pictures, they start to understand why they can't chew. They start to understand why they trap food, and they start to see the problems with their large black amalgams. We also recommend taking before and after photos on all of your patients so that you have these in a library to show them what the possibilities are based on how they present themselves. And another photographic tool is using cosmetic imaging. This has gone a lot further now with the introduction of digital smile design, where you can do 3D mock-ups and then show the patient with that mock-up in their mouth using video imaging and computer imaging and side-by-side imaging to inspire patients to want to have more extensive cosmetic and comprehensive dentistry. We also recommend taking a shade measurement early on in the treatment and then using some verbal skills that we have in our script book. And please, you can write to us or text or email us asking for some of those resources on how we start talking about patients wanting to have their teeth whitened, which tends to be sort of the appetizer to patients wanting restorative dentistry. So we talked about the verbal skills that are necessary to inspire a patient to want to have treatment. And the tool that we teach is called the triple here. Now, there are 3 things in here. Number 1, we talked earlier about the condition, the disability or problem, and the benefits. What we want to talk about now is the problem, the consequences of not treating the problem, and the benefits of taking care of the problem. PCB, problem, consequence, benefits. And you're going to see how they come into play as we go through the triple here. One of the things we've learned from marketing experts is that people act on things when they hear them more than once. If you watch an infomercial, it's not a 30-minute infomercial that you watch, but rather it is a 10-minute infomercial played 3 times. And so we're going to use the same theory in how we talk about treatment. Now, when the hygienist sees a patient and takes the photograph, what we want her to do is to seat that patient up. Again, we never speak to the supine position, and say, Mrs. Jones, you see this picture on the screen of this tooth with decay or a crack. That's a problem. You have a problem in this tooth. And if we don't do something about that problem, you could have pain or an infection, or you could even lose that tooth. When Dr. Wonderful comes in, he or she is going to describe some treatment that is going to make that tooth stronger, make it last longer, it'll be healthy, you'll be able to avoid pain and infection, and it'll be absolutely beautiful. So notice, we kept it as simple as possible. You have a problem. They now have ownership of their problem. We give them the consequences of the problem. You could have pain, you could have an infection, or you could even lose the tooth. And then we give them the benefits of the treatment, not the treatment. You see, the tendency is for us to tell patients, you need a crown. And as soon as the patient hears that word, they're starting to think in their mind, crown, I heard about those. I had a friend who had it. Sounds like it's expensive. I think it hurts. My friend had problems. It was a pain in the rear end. He had to come in, the temporary came off, and the entire time we're trying to validate what we've told them, they don't hear any of it. That is the reason we say the benefits before the treatment. And if we talk in terms of the benefits, inevitably what the patient's going to say is, doctor, well, exactly what are you going to do to provide that with me? And that's when we turn it back into the benefits. In order to make your tooth stronger, make it last longer, be healthier, help you avoid pain, infection, and look absolutely beautiful, in this case, we're going to do a crown. Now, that is the first part of the triple here. The second part of the triple here is when the doctor comes in to see the patient in the hygiene room. And after the regular greeting, what we want the doctor to say to the hygienist, not how's Mr. Smith doing, because then the hygienist is going to start talking about what she did as far as the prophy and how things are going on in the patient's life. I want to focus, I want to keep these clinical exams, hygiene exams, to 3 to 5 minutes maximum. What we see in so many cases is a doctor comes in to do the hygiene exam. They take 15, even 20 minutes, sometimes even longer than that. Now the hygienist is running behind in her schedule. The patient who's in the doctor's chair is not receiving treatment, so the doctor's going to run behind in the schedule, and the schedule falls apart. We want to keep these exams streamlined to 3 to 5 minutes by having the hygienist recognize what the doctors are going to see when they come in, so that the communication has already been started. And then so we want the doctor to turn to the hygienist and say, tell me what you were discussing with Mrs. Jones about that picture that's on the screen. And that's when the hygienist is going to turn to the doctor and say, I told Mrs. Jones that that tooth is a problem. And if we don't do something about that problem, she could have pain or an infection or even lose that tooth. And I also told her that when you came in, Dr. Wonderful, that you were going to recommend something for that tooth that was going to make it stronger, make it last longer, it would be healthier, she would avoid pain and infection, and it would be absolutely beautiful. Now what I want the doctor to do is to look at the picture. If the doctor needs to look at the x-ray, bring the x-ray up, but then put the photo back. The only thing that's of value to the patient on the screen are the photographs. And then turn, look at the tooth, sit the patient back up and say, Mrs. Jones, my hygienist is absolutely correct. That tooth is a problem. And if we don't do something about that problem, you could have pain or an infection or lose that tooth. And she's correct. We're going to recommend something for that tooth that's going to make it stronger, make it last longer, it'll be healthier, and you'll avoid pain and infection. Do you see any reason why we shouldn't go ahead and schedule the next visit to begin the treatment? Now, the verbal skills of our practices are extremely important. All of this that we've spoken about with the triple here and quite a few other things are in a resource we have, which is Smile Potential Scripts for Practice Success. If you'd like to obtain a copy of those scripts, which are a huge beneficial resource for all of your practices, just send us an email and ask for the scripts. So treatment presentation should not be done in a clinical room because that's a threatening environment. So we recommend it being done in a non-clinical consultation room. We recommend having the treatment coordinator in that consultation sitting on the patient's side of the desk so that they serve as an advocate for the patient. If the treatment is extensive, we recommend inviting the patient's significant other in because many people cannot make financial decisions about extensive treatment and extensive expenses alone. These consultations should never be interrupted. They need to, again, be non-technical in nature. We recommend using a treatment presentation folder to demonstrate the photographs, the x-rays, and the treatment plan, as well as any other supporting information, and to present comprehensive care, not present a little bit now and a little bit next time. One of the things that frustrates patients so much is when they come in every 6 months or every 4 months, and every time they come in, they have something else to be done because we didn't comprehensively diagnose them at the beginning. And these are some of the information that we show in a presentation folder. One of the things of a presentation folder is it increases the value, it shows a thoroughness, and it serves as a reminder to the other members of the family when they go home. So we want to change our practices from wants-based practices to needs-based practices. A long time, there was a little girl who came home from school one day and she said, you know, Mommy and Daddy, I think grown-ups are very sad people and they need encouragement. So she told them that what she was going to do the next day was go to the train station where they commute from work, and she was going to sell them little index cards with encouraging thoughts on them. And she stood on the train station and she said, encouraging thoughts, $1, encouraging thoughts, $1, and nobody bought one. So the next night she said, you know, I think that people don't want what they need. And so what I'm going to do is I'm going to sell them what they want and I'm going to give them what they need. So the next night she set up a lemonade stand at the train station and she said, lemonade, $1, lemonade, $1. And every time somebody bought a cup of lemonade, she gave them a little index card with an encouraging thought on it. And this young lady at that time understood one of the greatest principles in business. And that is that people don't buy what they need, they buy what they want. And Lori Greenier, the shark from Shark Tank, is the little girl who did this. And she has leveraged that understanding into becoming one of the wealthiest women in our country. It is a matter of understanding that as we lower perceived price, as we raise perceived value, we lower perceived price. So as we talk more about the benefits and the patients see the increased value of what we're doing, the price becomes more insignificant. That's when we see patients saying, doctor, you're the expert, do what you think is best. And that is because that patients buy everything in their life based on the experience they want to create. They buy fancy cars, fine dining, home theater, exotic vacations, not because they need them, but because they want how those things make them feel. Now, we talked earlier about the patients asking that question, do I really need this? Can I wait on it? Oftentimes when patients ask questions, we view those questions as an objection, when in fact these questions become opportunities to do the treatment. There are 4 basic objections to care: cost, fear, time, sense of urgency, and trust. Only one of them should ever be dealt with by the administrative team, and that's cost. Although in the back, we should set our teams up for success with that as well. The other 4, fear, time, sense of urgency, and trust, must be answered before the patient comes back to the checkout desk. So a patient who says, that sounds very expensive, I don't know if I can afford that. That's when we tout the abilities of our administrators. I just want to let you know that Mary up front is an expert on making this treatment affordable for you. And she will do whatever is necessary to fit it into a comfortable budget for you so that it'll fit into your cash flow. As long as you know that Mary is able to do that for you, do you see any other reason why we shouldn't go ahead and schedule the next visit to begin the treatment? Now the patient may say, is it going to hurt? Am I going to be able to go to work afterwards? Those are fear questions. And what we have to do is validate fears and then talk about all the things that we do. So when a patient expresses fear, we say, I understand how you feel. Other patients have felt the same way. I want you to know that Dr. Wonderful is obsessed with making sure that you're comfortable. They will give you as much anesthetic as you need to make sure the procedure is comfortable. They will stop several times during the procedure to make sure that you're still comfortable. At the end of the procedure, they'll make sure that they give you any medications that are necessary to continue that comfort. When you get home tonight, the doctor will call you to make sure that you're still comfortable, and we'll check up with you from the administrative desk tomorrow. As long as you see all the things that we're willing to do to make sure you're comfortable, do you see any other reason why we shouldn't go ahead and schedule the next visit to begin the treatment? Now, a patient may ask, how much time is this going to take? How long is the appointment going to be? And this is a little bit of a conundrum because questions are not always what they seem. If we do not know exactly what the patient is asking, we cannot give a valid answer. And in this case, we don't know exactly what the patient is asking. Is that a cost question? Because they may equate time in the chair with cost. Is it a fear question? Because they may associate time in the chair with fear. Or is it a time question? So sometimes to clarify a question, we must ask another question. And in this case, we would ask, is there something in your schedule that concerns you in making the next appointment for the treatment to begin? And that's when the patient may say, well, work has been difficult. It's been difficult for me to break away. It's hard when I'm on the computer all day long at work during a shutdown or when we're being still away from our offices. And that's when the team member will say, well, we understand your time may not be flexible, so ours is. Therefore, if it means we have to come in early to see you or stay late or work through lunch, we'll do everything that's necessary to make sure that the appointment time is convenient. As long as you know that we're going to ensure that your appointment times are convenient, do you see any reason why we shouldn't go ahead and schedule the next visit to begin the treatment? Now, the question that we will probably receive the most, other than cost, is sense of urgency. This is the one that comes up every time the doctor leaves the room and the patient turns to the assistant and says, do I really need that? Or the patient turns to the hygienist and say, can I just do the fillings and wait on the crown? Or they may ask the same question of the administrator. And sense of urgency, if we can overcome that, we will see the production in our practices grow enormously. And so there's a verbal tool to overcoming sense of urgency. It's called feel, felt, found. Feel, felt, found. We validate how they feel. By using the word found, we associate them with other people within the practice so they don't feel alone, they don't feel ostracized, they feel normal. People love to belong. That's the makeup of a good portion of our patient population, those that are people-oriented and um, people-oriented and introverted, and so that we make them feel like they're one with many of our practices. The feel, felt, found goes, Mrs. Jones, I understand how you feel. Many of our other patients have felt the same way and asked the same question. And now we guide them into making the right decision. I understand how you feel. Many of our patients have felt the same way and asked the same question. Those that followed the doctor's recommendation often had an easier time of it. The treatment ended up being less expensive, there was less discomfort, and the results were better. The patients who held off for one reason or another often had a more difficult time. The treatment ended up being more expensive, there was more discomfort, and the results weren't as sure. Doesn't it make sense to go ahead with that treatment and set up that next visit now? The last objection is trust. And this usually comes up with some of the younger doctors. I don't know how many of you on the call tonight fall into that category, but trust is one that if we can assure the patient in a positive way, we can overcome that easily. One of the best ways of overcoming trust is asking a patient, would it be helpful for you to speak to one of our other patients who had the same procedure recently and can tell you about their wonderful experience? 9 out of 10 patients who voice a trust objection, when given that option, will say, no, it's okay, and they will go ahead. However, for the 1 out of 10 who do say that speaking to somebody would be helpful, wouldn't it be wonderful if we had a library of patients who've been successfully treated, who have loved their care, and who would be willing to vouch for us? And when the patient says, yes, that would be helpful, wouldn't it be great if our clinical assistant could call up to our administrative team and have them get that patient on the phone so that during the checkout procedure, the patient could speak to that patient and hear the assurances of how wonderful a procedure it was and how good the experience was. So as we become better in overcoming objections and turning them to opportunities, we see tremendous success. And I'd like to just welcome into our program now Lex Fogel, who is from Care Credit. And there is no better way of getting patients to overcome that cost objection than by utilizing the services of Care Credit in third-party financing. So good to see you, Les.
Nice to see you too, Dr. Katz. Thank you so much for the introduction. I love everything you're saying. I think it's terrific. I know for one, I've been a patient of a tooth that was being washed by a doctor, and I called when I was in Florida, nowhere near my dentist. They go, we're watching that. And I'm like, well, I'm watching it in pain right now. I'm nowhere near you. So it's great to hear that and really move forward with dentistry as it carries on. One thing I just want to announce to everyone is at the beginning, you were mentioning contactless payments and incorporating technology to have a modern office. We have a lot of new features available. They're all free to our existing enrolled practices. I'll put my number up in the text box. If you just want to text me, I can get you these QR codes for contactless payments, even contactless applying, where your patients can do everything directly from their own phone and not have to hand anything back and forth with your treatment coordinators or your front desk. And it's something that's becoming very popular.
Mm-hmm. That's great. And, the one thing I will tell you is that we measure metrics in a lot of our practices and look at the analytics. And when we have practices set up their goals, what we see is that the practices that are meeting their goals more regularly generally will be using Care Credit about 10 to 15% of their revenue. But the practices that are knocking it out of the park, and we've seen a few practices this year, even after being shut down for 4 or 5 months, are $400,000 or $500,000 ahead of last year. Those practices are using Care Credit 35, 40%. We have one practice right now that's up around 43%. And isn't it wonderful to have the money up front when you begin that treatment?
That's definitely something I'm hearing a lot from providers locally, is getting that money now is even more important with uncertainty through the roof. and who knows where the money's coming from. So we certainly do that. And of course, it's no recourse. So once we fund you that money, it is yours. So I appreciate it. Thank you so much, Dr. Katz.
My pleasure, and thanks for being here. And thank you to Care Credit for sponsoring the program tonight. So what we've
Happy to
talked
do it.
tonight
Nice
is
to be back here.
sure. We've gave you some things tonight that are different from perhaps from what you've done, that are changes in the way that you go about treatment acceptance. Understand that to change the success of your practice, you need to change the way that you practice. And we've all been through this difficult period right now. So with all of the challenges, it's easy to say that opportunity is nowhere and that we've been dealt a blow. But again, it's getting back to what we talked about early on in perspective. And if we change our perspective of that last word, we can look at the fact that opportunity is now here. If we've utilized the time we were shut down to enhance our skills, if we take the time now to slow down and become more thorough in our diagnosis and more structured in our approach to treatment acceptance, what we learn now is that the opportunity is now here. And for the practices that we've been working with for the last 4.5 years, we work with 94 practices in the New York metro area, and now with a virtual format, we're working with practices all over the country. Those 94 practices have achieved over $50 million in increased revenue. That's about $514,000 per practice. We have organized some programs for dentists helping dentists. We run a dentist dedicated to success mastermind. If you're interested in that, that is a virtual meeting once a month where we have about a dozen of the practices we work with and some guest practices. And if you're interested, contact me. We do have 2 openings in the mastermind that's in going on right now. And it is a great way to hear what some of these successful practices are doing. And it's a community of sharing where they're eager to share their successes and to help one another with their challenges. We talked a lot about how we can generate restorative dentistry through the hygiene chairs. And we run a wonderful program called Hygiene Acceleration, which goes over the triple here technique with the hygienist. It goes over structuring and having good diagnostic criteria between the doctor and the hygienist so they're always on the same page. And it's also a virtual program that enables us to work with the doctor's communication skills in conjunction with the hygienist. Another module program that we have is Administrator Profitability. And this is one where very, very strong in teaching the verbal skills, organizational skills, scheduling skills, treatment and financial arrangement skills of the administrators. And we see this alone as being a tremendous benefit for the practices we work with, and certainly in combination with the rest of our coaching program. We want every practice to understand that we have been dealt a blow, but this blow has given us an opportunity to refine what we do, to become better at what we do, to provide a higher standard of care, to increase patients' perceived value of that care. And if we learn how to communicate that value in a way that is better than what we did before, we'll all come back stronger than ever. And with that, I want to thank everybody for being on this program tonight. If anyone has any questions, if you go to the right side of your screen, you will see that you can pull down a chat or the questions. I'll stay on for another couple of minutes to see if anybody has any questions to ask. Or if you would like to text me any questions, then my cell number is 516-524-7573. You can text me a question. I'll wait a couple of minutes to see if anything comes through. And if not, then I will just thank everybody for being here. I want to thank National Dentex Labs for hosting this. I hope that those of you who are on the program tonight are able to take something back to your practices tomorrow to increase your treatment acceptance. I also want to thank Care Credit again for sponsoring, and have a great evening. Be safe, be well, and here's the opportunity to be even better than before. Have a great evening, everybody. Thank you for being here.